Hi guys, this is my first video on the yoga channel. I made this channel because I like teaching the things that I've already understood, and I hope this helps you even a little bit. So let's talk about renal clearance. So disclaimer, I'm gonna really zoom in because I don't have a stylus and I'm practically finger painting my way through this video. Now, to understand renal clearance, there are a couple of factors, a couple of things we need to understand first. First is the structure of a nephron. Then we have GFR, renal plasma flow, filtration factor, and in this video I'm going to touch on the clinical aspect of renal clearance. Now let's look at the structure of a nephron first. So we have the Bowman's capsule, the PCT, which is the proximal convoluted tubule, the descending and ascending limb, and the DCT, which is the distal convoluted tubule. There are a couple of arteries present near the Bowman's capsule. The artery that takes blood towards the Bowman's capsule is the afferent artery, which goes into the glomerulus, and the artery that takes blood away from the Bowman's capsule, which is the efferent. It's very important to know the difference between afferent and efferent. Now, the main function of the glomerulus is to increase the surface area between the surface area of contact between the arteries and the Bowman's capsule, so that absorption of substances into the Bowman's capsule is made easier. There are also some capillaries near the PCT which essentially secrete things into the PCT or reabsorb substances. Now, if we're talking about glomerular filtration rate, so as from the name you can understand that it has something to do with the glomerulus. So glomerular filtration rate is basically, okay, so first let's talk about RPF, which is the renal plasma flow. Renal plasma flow is the amount of blood that is going through the Bowman's capsule. So let's say 100 ml of blood is going through the Bowman's capsule. Now GFR is the amount of substance, amount of plasma that has been cleared out, that has been absorbed into the Bowman's capsule. So GFR only has something to do with the glomerulus, whereas the RPF, which is the renal plasma flow, is also calculated by the amount of substance secreted into the PCT. Now let's slow down a bit. Let me explain everything in more detail. So we have the GFR. We know that for GFR we do not need anything sneaking in or sneaking out of the PCT. It is solely calculated, it is solely measured on this apparatus, right? Only the things that are absorbed through the Bowman's capsule are measured. So for this, we use creatinine. The concentration of creatinine in urine is used to measure the GFR. Creatinine is something that our body already possesses, but we can also use a substance called inulin. Inulin is not produced in our body, so we have to introduce it into the patient and then measure the amount of inulin in the urine. So this is used for GFR. Now the next thing we need to know about is RPF, which is renal plasma flow. For renal plasma flow, we use PAH, which is para-aminohippurate. Now, what is so magical about para-aminohippurate? So para-aminohippurate is basically, so we don't produce it and it is introduced into the patient, and every time an artery comes in contact with a nephron, para-aminohippurate is secreted into the nephron. So it really helps us measure the amount of blood that has passed through the glomerulus. Now, what is filtration fraction? Filtration fraction is the amount of plasma that has been filtered out upon the total amount of blood that went through the glomerulus. To understand filtration factor, let's look at some clinical things. So we have the Bowman's capsule, and we have our afferent artery, glomerulus, and efferent artery. Now, there are proteins present in the glomerulus and there are proteins present outside the glomerulus. Now we're going to talk about certain forces that are used in the process of filtration, that help in the process of filtration. So the blood in the glomerulus causes an outward force, which is the hydrostatic force in the glomerulus. There is the fluid in the Bowman's capsule, which causes a hydrostatic force in the opposite direction. Now these proteins that are present, all the proteins, what they do is they pull water towards them, and this is known as the oncotic pressure. So the proteins in the glomerulus are going to push water towards them, and the proteins outside the glomerulus are going to push water towards them. If you see, there are two forces in each direction, so you can kind of that's how you can remember this whole concept. So now, why are we learning about this? Okay, we understood that there are these forces, but how does that help? So let's talk about certain cases to understand these forces. Let's say that there is constriction in the afferent artery. What is going to happen? The amount of blood entering the glomerulus is going to decrease. Because there is a decrease in the amount of blood entering the glomerulus, there is also going to be a decrease in the glomerular filtration rate, which is going to cause a decrease in the filtration fraction. Now, let's say that there is a constriction in the efferent artery. What is this going to do? If there's a constriction, that means the amount of blood that is coming in cannot go out at the same rate. So that is going to cause a lot of pressure in the glomerulus. So the hydrostatic pressure in the glomerulus is going to increase so much that it's going to increase the glomerular filtration rate to make more space to facilitate the backlog of blood. So in this, what happens is what happens is the renal plasma flow decreases and the glomerular filtration rate increases to facilitate the decrease in renal plasma flow. So the filtration fraction increases. Now let's talk about another case. Let's say there is a stone in the ureter. If there's a stone anywhere down the line after the nephron, there's going to be a lot of pressure built up here. All of this pressure is going to increase the hydrostatic pressure on the glomerulus. This is going to decrease the filtration rate. And because it's decreasing the filtration rate, it's also going to decrease the renal plasma flow because there is so much pressure built up here. So renal plasma flow decreases, glomerular filtration rate decreases, so filtration factor also decreases. And that was it. Now I've realized I really zoomed in a lot. Here's the thing if you want to take a screenshot of these tiny texts. I hope this really helped. If you have any questions, any doubts, feel free to comment. Feel free to DM me on my Instagram page if you think it's like a dumb question, not that there are any dumb questions. And yeah, like, share, and subscribe. And thank you for coming.